Joining me for tonight's Big Picture Rumble are Horace Cooper, attorney and senior fellow at the National Center for Public Policy Research, Medea Benjamin, co-founder of Global Exchange and Code Pink, and Charles Sauer, president of the Market Institute. And thank you all for joining me tonight. Great to see you all. So you heard my rant. What do you all make of this? We're down to 3 large health insurance companies that are screwing us all and skimming hundreds of billions of dollars. 140 or 170 billion dollars a decade they're skimming off the top.
You make it easy to continue being your nemesis. That's what we're moving through 2016 to do. And that's because the reason why hospitals are merging is because of Obamacare. The reason why hospitals are merging is because of the highly regulative state of the healthcare industry. If you look at where it's not regulated, if you look at where it's unregulated or less regulated in the self-insured businesses, we have hospitals in Oklahoma charging 20% of what the nonprofit hospital down the street's charging. We also have hospitals in California, Virginia, Florida, and Ohio doing the same thing. Where we look at unregulated healthcare markets, we see low costs, high value, high quality care.
Those are not unregulated healthcare markets, and B, the regulation that prevents these kinds of mergers and acquisitions is called antitrust legislation. And Ronald Reagan did away with that in '82. And what did we get?
You're talking about a Band-Aid on top of something. You're talking about a Band-Aid on top of something.
No, I'm talking about creating a competitive capitalist system where there's actually competition. There isn't competition anymore.
But why should there be an issue that is really a life and death issue? It shouldn't be as part of the profit system. It should be, as it is in just about every single industrialized country in this world, something that is provided for as a right, a human right. And I thought it was great seeing that old clip of Hillary. I didn't know that she actually said that, but all the better if we're moving into a place with so few insurers that it can make it easier to move into single payer.
Give Hillary a week or two, and eventually she'll come around to your view for a week, and then give her another week or two, and then she'll come down with another position. That's what liars do. They say those kinds of things. But to your point, more broadly, explain why, even though all of these other systems have all of these assets and advantages, we see so much healthcare tourism to the United States, not just from Canada, not just from Britain, not just from Germany, but all over the globe. They come here because market forces are allowing for dynamic treatments that many places simply aren't going to be able to provide.
If you look at the actual numbers for us, what you will find is that more Americans leave the United States for health care than other people come to the United States. These huge, major markets in Mexico, particularly for dental care, huge market in Thailand for skin care.
Unregulated market. Unregulated market. Name another one. We'll go to an unregulated market.
Let's go to Cuba. Huge market in healthcare for Cuba, run by the government.
Prices online in 2009. Canadians called them right away.
Periphery. Why are Canadians, when they have high specialty intensive healthcare needs that are related to heart and vascular circulation issues, coming here to...
They don't come here. They stay in Canada.
That is not true. That is absolutely
I'm sorry,
not true.
Horace. Every time some right-winger comes on my radio show and starts going off on this, because SiriusXM covers Canada as well as the United States, I get this explosion of calls from Canadians going, what the hell is that person talking about?
You can read the New York Times. The New York Times is available in Canada as well, and they do interviews with people. The Minnesota Tribune does interviews with people who were Canadian and who came here.
You know, this is dueling anecdotes. The simple question is, how is it that you can have these 3 or 4 companies where the CEOs are making millions? United Healthcare, your CEO's made over $1 billion. You got over 100 executives who make more than $1 million a year, and every damn penny of it is coming right off the top of my premium.
No, you have a dueling anecdote. I had numbers and you didn't address the numbers. The fact is, the last time I was up on Capitol Hill with Dr. Keith Smith, who runs the Surgery Center of Oklahoma, he got 6 calls from Canadians in one day to come visit his system. You can stick with your anecdotes. I'll stick with the numbers. The fact is, when free market healthcare moves, people get better, cheaper care, and they get faster access to it.
Unregulated healthcare.
No, we don't, but we should be moving to that.
There's nowhere in the United States healthcare is unregulated.
In places where the
let's become like Mexico.
In the places where regulations are lower,
where actually people have free health insurance,
automatically drawn to that. There are advantages, and there are areas that we see presently where it could operate. Take plastic surgery as an example. because the types of treatments that are available in that category are less regulated than just something like heart surgery, you see all kinds of comparative advantages where specialists come in and they offer treatments that are remarkably beneficial.
Fact of the matter is that these are basically banks. These guys, they're not giving anybody a vaccine.
Is no justification for regulation.
They're not healing any children.
Your envy is no justification for that.
They're not doing anything except handling money. What the hell are they doing?
Which is what the NHS does.
Let's talk about what's basic health care, which is preventive care, and there's no money to be made in preventive care.
There's also no studies that show preventive care do anything. There's study after study that
you don't think if a woman gets a chance when she's pregnant to go into regular meetings?
That's actually not preventive care because she's already pregnant. That's care for a pregnant woman.
And there's no money to be made from that. It's just,
but back to my point about the NHS,
Charles,
they are essentially a bank.
I'm sorry, there are. And and in fact, there have been multiple studies on the effect of broadening, extending health care insurance. This was from the Harvard study, what, 3 years ago, when they came out and said 45,000 people were dying from lack of it. What they found was that the stage of cancers in places where people had access to health insurance was typically 1 or 2 as opposed to 3 or 4 far more advanced cancers in places where people didn't have health care.
Which is the opposite of the research that came out of Oregon.
More of today, Oregon, come on, that was a 6-month study. More of tonight's Rumble right after the break.